So, good evening, everyone. So, today I will be talking about transplant drugs. So, for the outline of the topic, I will be talking about organ transplantation, the principles of immunosuppression, immunosuppression drugs, drugs for transplant rejection, drugs for infection, and promoting adherence, which includes the nursing process. So, what is organ transplantation? It is a life-saving procedure. It is an acceptable treatment option when an organ fails. Two types of organ transplantation. It is cadaveric transplantation, which includes a healthy organ donated at the time of a person's death, is transplanted into the body of a patient with end-stage organ failure. Second is living donor transplantation. Kidney or a portion of a liver donated by a living person transplanted into the body of a patient with end-stage organ failure. So the principles of immunosuppression. Effective defenses against foreign organisms are provided by our immune system. The rejection of transplanted organs is caused by the same mechanisms. The fundamental idea behind immunosuppression is the use of several medications that modify various immune system functions, decreasing the likelihood of transplant rejection. So the first immunosuppressant drugs that I will be talking about is basilicimab. It is a monoclonal antibody that prevents lymphocyte activation mediated by the interleukin-2. It stops the body from developing an immunological reaction against the transplanted organ by blocking lymphocyte activation. It is administered intravenously. The side effects includes abdominal and back pain, coughing, dizziness, fever or chills, fatigue, weakness, dysuria, dyspnea, sore throat, edema, tremor, nausea, and vomiting, and anemia. So it should not, so the patient should not receive live vaccines because they may produce inadequate immune response. So caution is advised when basilicimab is administered with other drugs that lower the immune response because it may increase risk of infection. So second is calcineurin inhibitors. By attaching to cytoplasmic proteins that inhibit calcineurin phosphatase, calcineurin inhibitors decrease the immune system by reducing cytokine generation and inhibiting T lymphocyte proliferation. There are two CNIs. It includes cyclosporin and tacrolimus. The prototype of CNI is cyclosporin. So what is cyclosporin? Drug route is oral. Initial dosing of cyclosporin is 7 to 9 milligrams orally per day in two divided doses. The first dose is given 4 to 12 hours before the transplant or postoperatively in both adult and pediatric patients. Grapefruit and grapefruit juice have a negative effect on the medication metabolism, raising the blood level of cyclosporin, which can lead to hepatitis, acute renal failure or ARF, seizures, comas, and urologic disorders, and death. Elevated blood urea nitrogen and creatinine, hypertension, hirsutism, infection, edema, acne, hypomagnesemia, and hyperkalemia are the common side effects of cyclosporin. So, live vaccinations should not be administered to transplant recipients who are on cyclosporin because that may not have a sufficient immune response and run the danger of spreading the live virus's infection. Second is tacrolimus. So drug route is intravenous and oral. It is the second calcineurin inhibitor that has been certified for the prevention of transplant rejection in the heart, liver, and kidney. It has a boxed warning on it about dangerous infections and cancers. It is highly nephrotoxic. It has multiple common side effects, which includes tremor, diarrhea, headache, hypertension, nephrotoxicity, infection, and insomnia. Persons receiving tacrolimus have absolute contraindications for live vaccines, same as cyclosporin. So let's now talk about co-stimulation blockers. Beletsep is a first-in-class selective T-cell co-stimulation blocking agent indicated for use in combination with bacilimab induction, my, mycophenolate mofetil, and corticosteroids to prevent kidney transplant rejection. It inhibits T cell CD28. So CD28 is a pathway. CD28 pathway is critical for T cell activation, differentiation, and function. So drug route is intravenous. When taking belatacept, it is increased risk of developing post-transplant lymphoproliferation disorder. So the common side effects of belatacept includes infection, anemia, diarrhea, peripheral edema, hypertension, constipation, fever, cough, nausea, and vomiting. So caution is advised when belatacept is administered with other drugs that lower the immune response because of the increased risk of serious infection. So let's now talk about a mammalian target of rapamycin inhibitors. So for the prevention of organ rejection in kidney transplant recipients aged 13 years and older, so sirolimus, it is a prototype drug that inhibits T lymphocyte activation and proliferation and inhibits antibody production by binding to the FK binding protein, thereby inhibiting IL-2 mediated signal transduction. This results in cell cycle arrest in the G1 to S phase, so blocking T and B cell activation of cytokines. So there are two boxed warning for sirolimus. Use of sirolimus increases susceptibility to infection and the possible development of lymphoma and other malignancies, and the safety and efficacy has not been established in liver or lung transplant patients. Therefore, use is not advised in liver or lung transplant patients due to increased morbidity and mortality. Common side effects of sirolimus are peripheral edema, hypertension, hypercholesterolemia, constipation, abdominal pain, diarrhea, headache, and fever. Next is purine antimetabolites. So azathioprine or purine antimetabolite is converted into 6-mercaptopurine in the body, where it blocks purine metabolism and DNA synthesis, thereby suppressing T and B lymphocyte proliferation. It is indicated for the prevention of kidney transplant rejection, as azathioprine is well absorbed following oral administration. So the common side effects includes leukopenia, thrombocytopenia, anemia, infection, nausea and vomiting, anorexia, diarrhea, elevated liver function tests, malaise, myalgia, fever, and rash. So patients who receive azathioprine should have a complete blood count or CBC, including a platelet count, taken weekly during the first month, twice monthly for the second and third months of treatment, then monthly. So creatinine and LFTs should be monitored. Next is inosine monophosphate dehydrogenase inhibitors. So mycophenolate mofetil blocks synthesis of purine nucleotides by inhibition of the enzyme inosine monophosphate dehydrogenase or IMPDH, thereby preventing the proliferation of T cells and lymphocytes and preventing the formation of antibodies from B cells. It also may inhibit recruitment of leukocytes to inflammatory sites. So mycophenolate mofetil is rapidly absorbed following oral administration. So next is a corticosteroids. So prednisone, it is a corticosteroid. It is a glucocorticoid receptor agonist. It decreases inflammation by suppression of migration of polymorphinuclear leukocytes and reversal of increased capillary permeability. It suppresses the immune system by reducing the activity and volume of the lymphatic system. Prednisone suppresses adrenal function at high doses and is readily absorbed from the GI tract up to 90%. So in addition to their use in maintenance therapy, corticosteroids are used in high doses for the treatment of acute transplant rejection. So common side effects of corticosteroid use includes sodium retention, edema, hypokalemia, hypertension, nausea and vomiting, acne, rash, headache, dizziness, and vertigo and insomnia. So, drugs for transplant rejection. So, transplant rejection occurs when the immune system of the transplant recipient attacks the transplanted organ. This happens because the immune system recognizes foreign tissues and attempts to destroy them, just as it attempts to destroy the infecting organisms such as bacteria and viruses. Treatment of rejection with an anti-T cell antibody is used when corticosteroids have failed to reverse rejection or for treatment of a recurrent rejection. So, anti-thymocyte globulin or rabbit, it is a polyclonal antibody that blocks T-cell membrane proteins CD2, CD3, and CD4-5. This causes altered T-cell function and lysis and prolonged T-cell depletion, which begins within 24 hours. Common side effects of ATG rabbit includes high fever, chills, nausea and vomiting, headache, diarrhea, malaise, shortness of breath, leukopenia, thrombocytopenia, peripheral edema, and increased risk for infection. So close supervision of the patient is required during and after the IV infusion. So include frequent vital signs and assessment of the site for signs of extravasation. So patients should have white blood cell and platelets monitored frequently during treatment. So next is muromonab CD3, a monoclonal antibody that binds specifically to the CD3 complex of the surface of T lymphocytes. The CD3 complex is involved in antigen recognition and cell stimulation. Muromonab CD3 carries a boxed warning for the risk of anaphylactic reactions occurring with any dose and life-threatening or lethal systemic cardiovascular and CNS reactions. So common side effects of muromonab CD3 includes fever, chills, nausea and vomiting, diarrhea, headache, tachycardia, hypotension, dyspnea, tremor, rash, edema, fatigue, diaphoresis, dyspepsia, arthralgia, pruritus, leukopenia, increased risk of infection. Caution is advised when muromonab CD3 is administered with other drugs that lower the immune response because of the increased risk of serious infection. So drugs for infection. For bacterial infection, pneumo, pneumocystis jirovecii pneumonia, or PJP, is a life-threatening illness in immunocompromised patients. So routine prophylaxis with trimestoprim, sulfamethoxazole is significantly reduced the morbidity and mortality of PJP include following transplantation. So TMP SMZ is dosed once every morning or one tablet 3 times a week. So TMP SMZ can make the skin more sensitive to sunlight. So therefore, patients should be instructed to use a lotion with a minimum sun protection factor of 25 when in the sun. So next is for fungal infection. So nystatin is to prevent or treat thrush in the mouth and esophagus. It is usually given when the patient is on a high-dose immunosuppression regimen and is stopped when the steroid dose is reduced below 20 milligrams per day. So for viral infection, one common virus that patients develop after transplantation is cytomegalovirus. It may be present as a viral syndrome or as an invasive disease, and it plays a role in organ rejection. So transplant recipients receive antiviral prophylaxis with oral ganciclovir or valganciclovir for 3 to 6 months following surgery. So for the nursing process, assessment, assess for clinical signs of rejection, including malaise, fever, edema, pain over the transplant site, and increased weight. So assess for presence of risk factors for infection, including drugs, travel, and exposure to individuals with active infections. So assess for signs and symptoms of infection, including redness, swelling, pain, and elevated temperature. So assess immunization status. So assess nutritional status, including weight and history of weight loss. So for the nursing diagnosis, protection, ineffective related to the possibility of transplant rejection and risk for infection. So planning, infection is recognized early to allow prompt treatment. The transplant recipient and family members will verbalize understanding of early signs and symptoms of rejection. So the transplant recipient will remain free of infection. So for the nursing intervention, instruct the transplant recipient on the benefits of a balanced and healthy diet accompanied by exercise. To instruct the transplant recipient on proper adherence to the drug regimen. Patients should be instructed to avoid anyone with an active infection and to be careful not to injure themselves, which may increase their chance of acquiring a wound infection. They should stay away from anyone who has cold, mumps, measles, chickenpox, or other communicable diseases. So promote health education with patients and families in order to recognize and minimize the risk of complications and rejection and to facilitate optimum quality of life. So teach the recipient the signs and symptoms of rejection and infection and instruct them on when to call their health care provider. So teach the transplant recipient to self-monitor vital signs, daily weights, and blood glucose. Ensure the recipient knows when to call the healthcare provider. Transplant recipients and their families should be taught to wash hands properly, especially after toileting, before meals, and before administering drugs. So for the evaluation, evaluate effectiveness of the plan, including adherence to the immunosuppressive drug. So that's it, and thank you for listening.